Doctor, you were talking about monocytes? Yes, mononuclear leukocytes. Is that the cytoplasm which contains no granules? Well, only a few. And what is myelopoiesis? Myelopoiesis is the formation of blood cells and tissue elements from bone marrow. Doctor, what is myeloproliferative? Myeloproliferative refers to an increased production of myelopoietic cells and tissue. And phagocytes, Doctor? Phagocytes are of two classes of white cells. What are those two classes, Doctor? They are the macrophages, which absorb dead cells and tissues, and the microphages, which ingest bacteria. And plasma, Doctor, is what? Plasma is the liquid portion of the blood without cellular elements. And the plasma cells, or plasmacytes, are leukocytes, are they? Correct. Normally, they are absent in blood film. Yes, but occasionally they are seen in infection, but rarely present in circulating blood. Their function is to synthesize immunoglobulins. What are platelets, Doctor? They are a form of thrombocytes, which are round or oval discs, which control clot formation and clot retraction. Doctor, what is polymorphonuclear? Polymorphonuclear is having nuclei of variable shapes. And reticulocytes? Reticulocytes are immature red cells in intermediary stage of development between nucleate and anucleate forms. They contain a fine intracellular network and are normally present in the blood in small numbers. Finally, Doctor, what is serum? Serum is the liquid portion of the blood after fibrinogen has been consumed in the process of clotting. Doctor, the conditions primarily affecting the red cells are what? Well, primarily anemia, which is a blood disorder characterized by a reduction in erythrocyte count. Hemoglobin and hematocrit, although not all three findings may be present. It is usually a manifestation or a complication of a disease, not a diagnostic set of functions. A condensed version of Wintrobe's etiologic classification of anemia is presented. Is there a deficiency factor in the red cell blood production? Yes, so-called erythropoiesis. And an iron deficiency anemia? Well, that would be the depletion of the body's iron storage, which may be followed by an inadequate production of hemoglobin and a reduction of the oxygen-carrying capacity of the blood. What about the megaloblastic anemias? The common denominator is a disordered synthesis of the deoxyribonucleic acid, commonly known as DNA, due to deficiency of vitamin B12 or folic acid. Doctor, is there a normally dietary vitamin B12 which interacts with a mucoid secretion of the gastric fundus? That is correct. It is the intrinsic factor of Castle. In the absence of this factor, B12 cannot be absorbed by the ileum and nutritionally utilized by the body, neither sorbed nor absorbed. Doctor, folic acid is B12? Yes, and folic acid deficiency may be caused by malnutrition, malabsorption, increased requirement or loss of folic acid, and defective folate metabolism. What about pernicious anemia? Pernicious anemia is a prototype of a megaloblastic anemia, usually associated with marked vitamin B12 deficiency. Laboratory findings reveal a very low red count, often below 2 million, a hemoglobin relatively less reduced, and achillea gastrica or the absence of or diminished gastric juice. Anorexia, sore tongue, weakness, fatigue, a waxy pallor, and neurologic damage are common clinical manifestations.
Impossible.
How do you get that?
I don't know.
I tried.
No, I'd rather just get out of here.
Oh yeah, we're going to lunch. I was going to lunch.
So vitamin B12. That's vitamin B.
And then
12.
on the bottom, it's a small 12. That's what they put in the
Well, how do you put that in a...
I would just put capital B and then 12 next to it. I mean, I don't know how you get lower.
Yeah, there should be a
Maybe there's something on
the
there might be something on the computer, but
because
I don't worry about that.
as rudimentary as my software is, it allows you to put a subscript.
But did you notice that the pH is here located?